Okay, so this is the beginning of my NG insertion video. Alright, so to begin this video, I have, before entering the room, I have clarified the order to make sure that that there was an order for this. The reason why, this is Bobby NG. We'll be having a NG tube inserted due to hyperemesis after an appendectomy and coming back to the hospital. So we will be inserting a Salem sump into Bobby NG. Bobby NG is here for that. Yeah, so I verified the orders. I've made sure that I will not be doing this procedure when there is medications due. I have verified that there is no medications that made her drowsy or anything like that. I have checked the level of consciousness to verify that she can understand orders and that there's nothing that's going to hinder my insertion. Alright, so that's fine. So I've gathered all my supplies. All my supplies are here. And then I'm going to head into the room. Let's head to the room. Alright, I'm going to knock, 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 knock. Hi, my name is Desi. I am your nurse today. I just want to verify that I have the right room. So can I get your name and date of birth? And I'm verifying that with the MAR, just to make sure. So now I'm just going to, and that I have the right room, I verified the right name. Okay. All right. I'm just gonna raise you up just so we can talk a little bit better. Okay. So I saw there was no contraindications to raising the bed and having her sit at a 45-degree angle.
So the first thing I'm going to do is ensure privacy. I've got all my supplies gathered.
Of course, I've already made sure that the room is private and that there are no other people involved.
Can I just have you verify your name and date of birth?
I'm just going to turn this a little bit. Making sure that she is at least a 45-degree angle.
We can do
Okay. Seems to be just a high Fowler's position. Alright, so I provided privacy.
It's okay.
Made sure that the people who are in the room are supposed to be in the room. I verified the name and date of birth. Alright, so did your doctor tell you you would be getting an injection today? He did. Okay, well let me explain a little bit more about it. So you come back to the hospital after your surgery and you're having problems with nausea, vomiting, and that thing. So this NG tube here is just going to allow us to suction some contents out of your stomach and help with that vomiting, okay? Alright, so it's going to be a little bit painful. You may feel some gagging, feel like you're going to vomit. You may
Hi,
feel
my name is Sadie. I'm going to be your nurse today.
a little bit of pain.
Can you go ahead and tell me
But
your
I want to
name
make sure
and
that
date
you
of
know that
birth?
this is all normal, but we're going to take care of it, okay? You may tear up and gag.
Great. Do you have any allergies?
You may feel some watering, like I said. Alright.
Great.
So, any questions before we begin?
I know that you
Okay,
have
I'll also
recently
explain
had
as we
surgery
go
and that you
so that we
had,
can make sure that you
nausea,
are
vomiting. Did the doctor
completely aware of
explain
what's
to you
going
that
on,
we're gonna
okay?
insert an
Alright,
injection
so let's
today?
begin. So I'm going to
Okay,
set
so
out
what
my
that is it's gonna be a
supplies
tube
not
that's gonna
on
go up
the
your nose,
bed,
down the back
but
of
the
your
bedside
throat,
table, but
into
for
your
this purposes I
stomach,
have the
and
video
hopefully relieve some of
being
the
recorded, so I would set this up on the
discomfort
bedside
from
table
nausea and
on top of a
vomiting.
clean
Questions?
workspace.
As we're going to go up your nose, and as
Of
we
course,
hit
I
the back of
provided,
your throat,
I did
you
hand
may gag a little
hygiene
bit.
before I came in.
I'm going to give you paper towel in case your eyes start to water at that time.
Alright, I'm going to perform hand hygiene again.
And
glove.
I'm going to have you tuck your chin to your chest
Hand
and make sure
hygiene.
that you are swallowing as we go. It's going to help to facilitate that
Glove.
tube to go down quicker. Any questions? Okay. So before I get started,
Okay.
I'm going to
So now,
verify.
I'm just going to drape this over you
the
in case you
And
just to
make
keep you
sure that
clean.
there's no obvious
I'm gonna cover this over you, just like that.
deformity with the septum.
This would be a bath
or
blanket
within the
or
oral cavity.
a drape covering. All right. So
Okay.
I'm gonna check the patency of the nares first. All right. And I'm gonna pick my. It's gonna be this side, the side closest to me. I would look inside. I'd make sure that the membrane's not dry or cracked or anything like that. Make sure that I see the septum is not deviated and there's a nice opening for me to work with. Okay, now that I've verified
And
that,
with that,
I'm gonna go ahead and measure.
I'm gonna measure
From the earlobe,
placement for this,
the nose,
from going from the tip of the nose to the ear,
and then down to the xiphoid process.
down to the xiphoid
Okay,
process.
now that I've gotten that, I'm gonna go ahead and tape it off.
Approximately 53. And I will mark that with the marker.
Tape that area off so that I know how far to insert my tube.
And 3.
Okay, so now I'm gonna provide some
the
lube
patient with the emesis basin as well as the tissue.
at 2 to 4 inches.
If at any time during the procedure
Okay.
you're having any difficulty
I'm
breathing,
gonna
or
provide an emesis bucket,
significant pain, I want you to
and
hold up
I'm gonna
2
keep.
fingers for
This
me.
is gonna be my water
so
glass.
that
We're gonna
I
pretend it
can
has a straw
stop.
in it. Make sure that it's filled with water and it's already prepared.
I'm going to go ahead and
Okay.
stimulate a little bit further. I want to make sure that
And-
the patient is in
And now we
the
will begin.
collar's
All right, are you
position.
ready? I'm gonna be pushing this upward and into the nose. Gently upward and back until I hit a gag. She starts to gag. I'm gonna pull back just a little bit just to stop that gag reflex. Okay, here's some tissue. It's okay. It's gonna be okay.
I want you to
This
flex
is
the
normal.
head
This is what's
towards the
normal
pillow.
for me.
I'm going to lube
Okay.
approximately 2 to 4 inches
All right.
on the Salem sum.
Now that my patient has been comforted and stopped gagging,
And
all right, are
you're
you
gonna
ready
go
to
up
begin?
closest to
All
me.
right. So then I'm gonna go ahead and advance now that the gagging reflex has stopped and my patient is comforted. I'm gonna ask you to tuck your chin into your chest for me. Okay. And I'm gonna provide this
If there's
water.
any
I need you to
resistance,
sip.
I would
Every time
stop.
you sip, I'm going to advance. And when you're breathing, I will stop. Okay. Remember our hands. Ooh, we have established a hand signal before I began. It was this. Okay. Ready to begin? And just use the hand signal when it's too much. Okay? Okay. Alright, so I'm going to keep advancing. It seems like I cannot, but I would advance to the point of the tape where I taped it at. If she began to be cyanotic or a lot of gagging, coughing, reflex, I would open the mouth and I would take it with the tongue depressor and make sure that it wasn't being curled in the back of the throat. If that was the case, I would pull back out and advance again. Okay, so we've reached the point where the tape. Okay, so then I'm going to loosely secure it to the side of her face with some tape. Okay, and now clean up my mess here. And I would send Bobby down to get an x-ray to verify placement. Before I do that, I would aspirate some of the stomach contents to verify that it was yellow or green. If it was white and fluffy, then I'd know I'm in the wrong place. My tape is not sticking. We're gonna pretend like it did stick. Loosely secured to the cheek. Like I said, I would aspirate, make sure that the contents are green or yellow, not white and frothy. I would check the pH to verify that we are actually in the stomach, and it is where it needs to be. All right, my patient has come back, and it is in the right place, it's the right placement, so then we're going to go ahead.
I have already verified
And so now that we're verified that it's in the right place,
And explaining that this
we're
is
gonna
the
tape.
patient and then performance from there.
We're gonna split. It's about a 4-inch tape.
Hi, my name is
2-inch
Sadie and
split.
I'm going to be your nurse today. Can I verify your name
Wrap
and
it
date of
one
birth,
way
please?
and the other. Securely. Make sure this is secured
Okay,
to the
great.
cheek.
I understand that you've been having some pretty
Alright.
significant
Can you
nausea
go ahead
and
and turn your head
vomiting
that way
since
for
your
me?
surgery the other day.
We're gonna turn the head to make
Did
sure
the
that we
doctor
have plenty of
explain
space
to you that you're
when
going
we
to be
secure it
getting
with
an
the
NG2? Okay, so what that is
pen.
it's
Oh,
a
there we go.
tube that's going to go up your nose, down the back of your throat, and into your stomach, and hopefully relieve some of that discomfort for you. Do you have any questions? Or hand hygiene?
Secured it to you.
I'm going to make sure that the bed is in
Alright, so now it's loosely
high
secured.
Fowler's position.
Sure. Alright. I'm gonna go ahead and connect it to the suction. Okay. Here.
Are you filming?
Yes.
How much money?
Almost done.
Finish.
Okay. Okay, so I'm almost done.
Clean gloves.
Okay. So now that I've connected it to suction,
I'm going to
I would provide oral hygiene,
explain to the patient. I
and
want you
nasal
to flex
hygiene,
your head against
making sure that the mouth
back
stays
of the
moist
pillow.
and the nares stay moist.
Guide this,
I would have provided some anti-aesthetic to the nares if that was what was prescribed and what was needed. And I will come back every 2 to 4 hours based on the orders to provide oral care and check the nares and make sure that patency is correct. Alright, is there anything else I can do for you? No? Okay. Then I'm gonna gather my supplies.
Swallow, sip, sip, swallow.
Okay.
And that'll help you to get the tube down easy
Alright.
into your
I would return the bed to the lowest setting per resident. If they want to sit up or sit down, I'd make sure though that the pump is below
extreme discomfort,
the stomach.
any difficulty
Alright.
breathing. I want you to
I
put
take
up
off my
2
gloves.
fingers and
I'm
tell
gonna
me
perform hand hygiene,
by doing
leave
by
and
doing that
document,
so that I
make sure
can
that the room
stop
is
the
safe before
procedure,
leaving.
and then we
Alright.
can
And that's the end of my video. Thank you.
after